Welcome to the World Health Organization. In this video, you will learn about the ICD-11 content model. The ICD is the global standard used to report diseases and health-related conditions to compile useful health information. The ICD is currently undergoing its 11th revision, in which you may participate through a web-based tool, the ICAT, or International Collaborative Authoring Tool. To be able to do so, however, you will need to understand the basics. This video has educational objectives. At the end of the video, the viewer will understand the ICD-11 content model and the content model parameters. This video is only for introduction purposes. Additional technical details and further specifications can be found in the accompanying text, the ICD-11 Content Model Reference Manual.
So I've read the reference manual. What's the purpose behind having the content model?
The ICD classifies diseases and health-related conditions. However, the classification of ICD has not been in a structured format. The purpose of the content model is to provide a structured and systematic framework for the ICD classification units. It will also provide us with good and complete definitions for each of the classification units.
Okay, but why do we have to have the content model? What are the benefits?
There's many reasons for having the content model. The ICD classification, its categories, its properties can now be defined in a logical way, and this will stop any ambiguity for the users when they look at the classification units. It's also a computerized system, so this will help with the electronic health information.
The content model contains 13 parameters that describe an ICD entity. Each one of these will be described in this video. The first parameter is the ICD entity title. The ICD entity title is the name. It should label the entity in a clear and meaningful way so that the user can understand the content of the entity quickly. The title should reflect current scientific knowledge. The term ICD entity is used as equivalent to ICD concept. ICD entities can be categories, blocks, or chapters.
Can we change these entity titles?
Yes, you can, but it's a very serious decision to change them. You need to provide us with a reason why you would like the change and to provide scientific evidence for the change. The advisory group and the revision steering group will review any changes submitted.
Okay. Also, while I was reading the reference manual, it mentioned fully specified names. What exactly is meant by a fully specified name?
A fully specified name is the title of an entity that can stand alone. So without any contextual information, a fully specified name will help tell us exactly what this disease is. So you can have an example of angina, angina pectoris, myocardial infarction, or tonsillitis. The fully specified name will tell us exactly what the disease is.
The second parameter is classification properties. Classification properties in ICD include information on how and where an entity is placed in a particular classification, including its relationship to parents. In a classification, there are parents, children, grandchildren, and so on. For our purposes, a parent is the code above in the hierarchy, and a child is the code below. These assist in viewing the ICD as a tabular list, which we call the linearization process.
Why is it important to specify the parent?
The specification of the parent will enable us to group the classification at different levels.
Okay.
So at the moment, sometimes diseases may be classified according to one logic, sometimes by another logic. By assigning all possible parents, we're able to use the ICD in multiple ways.
We're also asked to specify the type of an ICD entity. What does type exactly refer to?
Type's very important. In the past, the ICD classified the diseases and the health conditions, but it didn't give us a definition as to what exactly they are. So we're now trying to sort this out, and by doing so we will be assigning types. For example, a disease, injury, sign or symptom, disorder or syndrome, or in some cases it might even be a group of types. You'll find the definitions for types within the reference manual, and it's important to be sure that within your proposal there is a type. It's also important to note that signs and symptoms and disorders and syndromes are not differentiated within the content model.
The third parameter is textual definition. Textual definitions for each entity give key descriptions and guidance on what the entity is and what it is not. This is a succinct scientific definition to inform users, such as coders, analysts, or translators, about the meaning of that particular entity.
Why are there two definitions? There's one long one, one short one.
The reason we've got two definitions is because of the print version. We have a short definition, it will be 100 words or less, and this is for space when we print the ICD books. The long version is the electronic or the computerised version, and there is no restrictions in the ICAT tool for the length of the definition.
But shouldn't these two definitions be compatible?
Definitely. The long definition will provide the format and the information for the short definition. It will also provide information for further parameters through the ICAT and the content model.
Parameter 4 is terms. ICD terms match clinical phrases to guide users to find the right code for the expression they are looking for. Synonyms in the ICD are alternative names for the entity. For example, heart attack is a synonym for myocardial infarction. Synonyms are used to indicate alternative names which are commonly used for the same entity and to enable coders and translators to locate the specific term. Common terms and medical jargon may be included as synonyms, but they are not intended to be used interchangeably with the entity title.
What are the base index terms?
The base index terms indicate the index which will make up volume 3 of the ICD. This will be the link between clinical phrases and the ICD code. It will consist of synonyms and narrower terms, which are the children of the concepts.
And what about the exclusions or exclusion terms? Why do we have those?
These are terms that are outside the conceptual space of the entity. So within an entity, there are things that fit inside, but there are others that belong outside. Sometimes the title of the exclusion term might indicate that it belongs within a particular entity, but in actual fact, it belongs somewhere else.
The fifth parameter is clinical description properties. Anatomy and physiology have been the organizing principles for the ICD for over a century. This parameter identifies how different groupings have been made.
When I'm defining an ICD entity, should I use anatomy or physiology?
Both can be used, both anatomy and the physiology together, depending on the different needs.
So when you mention body structure, this would be anatomy, right?
That's correct. Anatomy can also apply to the topography. Another structure is morphology, which is the microscopic properties of histopathology. And this describes the cellular type and will be applied to tumours and skin lesions.
How quickly does a disease develop? How long does it last? At what age is the usual onset? The sixth parameter refers to temporal properties. Temporal properties identify these types of characteristics related to a disease. For example, acute myocardial infarction refers to ischemic lesions of the myocardium up to 28 days. However, the term acute may have a different meaning in another disease or disorder.
The term chronic may be used differently for different diseases, right?
Yes, that's correct. In some diseases, it may be months or it may be days. In the content model, we want you to put this in the duration and have it in real time. It might be minutes or it might be years.
Mm-hmm. What about the same diseases among adults or children?
A certain disease may cover a whole lifespan, and depending on the time, there could be different characteristics. So an example is juvenile diabetes mellitus and adult diabetes mellitus that may have different characteristics.
Mm-hmm.
Parameter 7 is the severity of subtype properties. In the ICD, severity of subtype properties refer to the commonly seen levels of severity in a disease or disorder. Many diseases in the ICD have different levels of severity, such as mild, moderate, or severe. Such severity levels may apply to many diseases, such as anemia, deficiencies, heart failure, kidney failure, or different stages of cancers or infections. The content model allows us to identify severity subtypes with operational descriptions.
What about a case where there is no severity subtype for a disease or disorder?
This in actual fact is going to be the default. More than half of the entities will not have a severity subtype.
How do you define mild, moderate, and severe?
The content model needs to have these terms defined. So for example, with mild hypertension, we will need to have defined the highest and the lowest of the BP readings, and this will give us the complete definition for mild hypertension.
What about the severity of neoplasms then?
In oncology, there is a internationally recognised scale called the TNM. So if this is a case where we have one, this will be entered at option 3.
Parameter 8 is manifestation properties. Many diseases are characterized by a set of signs, symptoms, or other manifestations. For example, a myocardial infarction is characterized by chest pain, EKG changes, and laboratory findings in some enzyme levels. The content model allows us to capture these findings and to link them to the ICD entity.
So we have to list all possible symptoms of all the diseases?
To the extent that they help with the definition of the disease and any diagnostic criteria, yes, you will have to.
Well then what about laboratory or imaging investigations?
Same principle applies. If it helps define the disease, provides diagnostic criteria, then yes, you will need to list them. So an example is with a myocardial infarction, the ST elevation and the creatinine kinase are very valuable in identifying these cases.
The 9th parameter refers to causal properties. Causal properties are those things which cause the disease, disorder, or health problem that is included in the entity. These may indicate the basic grouping, underpinning a group of similar entities. These could include agents such as microorganisms, medications, or genomic linkages.
What about those factors that aren't necessarily a causal linkage, but do increase the risk of a disease?
It's a very good question because there are factors that are known not to be causal, but definitely increase the likelihood of a disease, and we need to capture these. We do this in the content model under risk factors. They may be physical, they may be social, they may be environmental characteristics. At the moment, the list of risk factors in the content model is from the WHO study of the comparative risk assessment.
The 10th parameter refers to functioning properties. When people are ill, they may not function as they would normally in terms of daily activities, such as carrying out their household chores, taking care of themselves, going to work or school, or taking part in social activities. Functioning properties in ICD tell how an individual that has the relevant disease may be limited in what he or she wants or needs to do. The International Classification of Functioning, Disability and Health, known as the ICF, provides the basis for completing this parameter.
Why do we have to capture the functional impact then?
In some cases, the diseases are used on medical certificates, so they will tell us whether the patient can function in a particular task. So for example, drive a car, attend work, go to school.
Functioning isn't a part of severity?
In some instances, there is a correlation between the two, but in theory, they are two independent entities. So the ICD content model is separating the two. An example is with severity of dementia. The actual severity is based on the number of motor neurons that are involved. The functioning will relate to a patient's behaviour or the cognitive tasks that they are actually able to perform.
The 11th parameter refers to specific condition properties. ICD has traditionally been used to produce indicators for specific conditions, such as maternal mortality, infant mortality, or the global burden of disease. Specific condition properties relate to information that is not captured in other places. They describe in more detail diseases or conditions that are specific or related to a certain state of the patient. For example, pregnancy, infant mortality-related, and sex-related diseases are flagged in this parameter.
Should I code all pregnancy-related disorders here?
Indeed, you should. This will enable us to have all the disorders related to pregnancy captured in a unified coding system. Another similar situation is that for biological sex, because this can validate a code. So for example, a man cannot get pregnant.
So then this is also the place where I would identify infant mortality?
Yes, you would. Infant mortality will go here as one of the life cycle properties. You will also be able to put in here disorders related to pediatrics, geriatrics, or even adolescents.
The 12th parameter refers to treatment properties. ICD has historically included some treatment characteristics, such as insulin-dependent diabetes or treatment-resistant tuberculosis. In ICD, treatment properties are defined as attributes of medical care given to a patient for an illness or injury.
Will this mean that we link every disease with a treatment?
No, not really. Just those that will be diagnostic criteria for the treatment properties. In some cases, there are specific applications where users might like to link the ICD code with particular WHO treatment guidelines. Primary care is a really good example of this, but it needs to be useful information and management for the ICD codes to be relevant. So this becomes the articulation point.
And finally, we come to the 13th parameter, diagnostic criteria. For some chapters of the ICD, specialty adaptations have included diagnostic criteria, which state the guidelines or principles by which a condition may be diagnosed. These are operational definitions, which are standard logical expressions that describe the signs, symptoms, laboratory findings, or other relevant attributes that are used to define an ICD entity.
With ICD-11, what would I do with my diagnostic criteria for a disease?
What we're going to get you to do is list these in text. Later on, what we'll do is look at them for consistency with definitions and with other values. In the future, we may also evaluate these with other uses.
Thank you for watching. We hope that you have found this video helpful in your work. If you still have further questions, remember additional details can be found in the reference manual, or you can contact WHO or ICAT staff.